Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, dental problems are common health conditions that many people ignore sometimes. Well, dental problems affect a person's nutrition, self-esteem, and overall health and well-being. They may also be symptoms of an underlying medical condition or cause chronic problems if left untreated. So, to discuss on common oral problems, we are being joined today by Dr. Kaushik Sarmah, Senior Consultant Dental and Maxillofacial Surgery from Healthcity Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Dr. Kaushik, for joining to Good Life, the health show. So, today the topic which we will be discussing is common oral problems. Okay. Of course, we'll touch on the topics which we'll be taking, but people who are watching at this point in time, the viewers who are watching at this point in time, must be having a confusion in their mind regarding the term oral. Now, what is oral health? Just for the benefit of viewers, would you like to tell them about what is oral health in general?
Okay. Generally speaking, oral means it includes everything in your mouth, right from your dentition, your tongue, your inside skin, which we call the mucosa, right? And then your jaw bones.
Okay.
This proper oral health means when you are free from any complication regarding all these areas. Suppose you are having a foul smell, or you are having a malaligned tooth, or you are having a carious tooth, you are having a pain, you are having a tumor or abscess. These are things that affect your oral health.
Okay, so these are the things we are talking about: tooth, teeth, and the gums.
Not only teeth.
Only teeth, gums, the underlying skin, and also the tongue. So this is what exactly is meant as oral and oral problems. Now, if we talk about, doctor, the common oral problems which everybody might have faced in their life or maybe is facing right now. So what are the common health problems? What are the common oral health problems?
See, in general, in India, if we see, especially in the northeastern region, the main underlying problem is the awareness. They don't know that every 6 months you're supposed to do a scaling, the basic thing. That is the cleaning.
Okay.
So when you don't do that, your sugar materials get stuck to your tooth surfaces where they harbor all these microorganisms, and they solidify due to calcification and all that. So which we call as calculus or stones. So you not supposed to let it accumulate.
Okay.
So you should go for every 6 months one proper scaling and just a checkup.
Just a checkup.
That is the main thing everyone must follow.
Okay, okay. So this is a basic thing which everybody should keep in their mind. All right, viewers, we are having a conversation regarding the common oral problems. So numbers are flashed on your television screen. So if you have any queries regarding the topic which we are discussing, please call up and ask your question. Dr. Kaushik Sarmah is with us. Probably he'll give you all the answer. Now, doctor, coming back to you again, we had an idea about the common problems regarding the oral topic which we are talking at this point in time. Now, you were in Chennai for quite a long time. Now, if we talk about the difference of the treatment there, difference between Chennai and the Northeast India, the problems which the people face there, depending on the climate, depending on everything, the lifestyle. So what would you like to tell on that?
See, in southern region, the etiological difference is there. Like I will say in northeastern region, the main cause is the pan chewing habit or tobacco use is very high.
Okay.
So you will see more of cancerous lesion and pathologies related to tobacco, which is relatively less. It's there, but relatively less in southern population.
Which is mostly seen in Northeast.
Northeast, right.
Okay.
And then same ways, but there is a generalized, as I said earlier, awareness problem. So same thing is prevailing there also. But I would say that in those areas, in southern areas, the development in general is in medical field or dental field is much more better
Okay, Doctor will
well
talk.
equipped.
All right, Doctor will talk on that. We have a
Right.
caller. Let's take the call first.
Right.
Hello.
নমস্কাৰ মই চানমাইৰ পৰা ধুবুৰীতে ক'লো
আমি শুনি আছো প্ৰশ্নটো কৰিব
মই এটা বস্তু জানিব বিচাৰিছিলো মানে কি মোৰ দাঁত কেতিয়া মানে অলপ মাজে মাজে গুটকা খাওঁ কাৰণে অলপ ৰঙা পৰিছে তাৰ কাৰণে কি কৰিলে ভাল হ'ব
হয়
হেল্ল'
হয়
হয় মানে মোৰ দাঁত কেইটা অকণমান মানে ৰঙা পৰিছে মানে মাজে মাজে মানে গুটকা খাওঁ আৰু
হয়
কি কি কৰিলে মানে ভাল হ'বনো
হয় প্ৰথম আপুনি এই পান চিউইং হেবিট যিটো গুটকা চিউইং এইটো ইমিডিয়েটলি আপুনি বন্ধ কৰিব লাগিব যিহেতু এইটো ষ্টেইনিঙেই নহয় আপোনাক ভিতৰত বহুত চেলুলাৰ চেঞ্জ কৰি থাকে কোষবিলাকত গতিকে এই হেবিটটো আপুনি ইমিডিয়েটলি ষ্টপ কৰক আৰু ৰিগাৰ্ডিং দ্য ৰেড ষ্টেইন ৰঙা ষ্টেইন যিটো পৰিছে সেইটো আপুনি এজন ডেণ্টিষ্টৰ তালৈ গ'লে আপোনাক আল্ট্ৰাছনিক স্কেলিং কৰি আৰু আজিকালি বহুত ধৰণৰ ব্লিচিং টেকনিকো ওলাইছে আপুনি শ্বেডিং মেচ কৰিও হোৱাইট কৰিব পাৰে বা নেচাৰেল যিটো আমাৰ কালাৰ সেইটো আপুনি পোষ্ট স্কেলিং পাব পাৰে আফটাৰ স্কেলিং এণ্ড পলিচিং
All right. Thank you so much for calling. Well, Doctor, this is a very common question, a very common problem being faced by people because of their things which they have opted. Now, on that note, you have already mentioned to the viewers that you have to keep down the thing which you are, the supplements which the people are taking. Now, on that note, if the people still continues with those things, so on that note, what is the suggestion to you? What is the suggestion you would like to give them?
See, I'll tell as an example, this gentleman who called just now, there's a level of unawareness that he is taking gutka, but the thing is only he's bothered about is the red stains, right? But underneath that, the cellular changes it's producing in a daily basis for a long time, which are irreversible after a point of time.
Okay.
He should be aware of those. It's our responsibility. We do that. And even to one point, educational institution can promote those kind of awareness. So that's the thing.
Okay, so we'll come to that awareness part, Doctor. We were having a conversation regarding the general oral health problems in southern states and talking about the northeast states.
Yeah. So there, one thing which is coming up is multi-specialty thing. Now, if we see in dentistry has gone like in medical field, we have gynae, we have orthopedics. Same thing we can see in the dental field. There is a pediatric dentist for your babies. There's orthodontist for malaligned tooth. There's a oral maxillofacial surgeon for your cancer cases or your trauma, bike accidents or any fractures, jaw bones. So it has gets divided into many
subsections, subdivisions as well. Okay, Doctor, we have another call. Let's take the call. Hello.
হেল্ল' নমস্কাৰ মই চৌটো চাই আছো মানে মই ডক্টৰৰ লগত কথা পাতিব খুজিছিলো
ডক্টৰ শুনি আছে আপোনাৰ প্ৰশ্নটো কৰিব
হয় মানে মোৰ দাঁতত গুটকা মই নাখাওঁ বাৰু তামোল অকণমান খোৱা হয় তাৰপিছত দাঁতত মানে মাজত অকণমান ফাক ফাক হৈছে আৰু অলপ বিষাই থাকে মানে কি কাৰণত বা কিবা হেৰি কি হৈছে মই সেইটো জানিব খুজিছিলো
হয় আপোনাৰ বয়সটো জনাব নেকি
বয়স 30
আপোনাৰ এই যে ফাক ফাক দেখিছে কোন ফালে সন্মুখত পাইছে নে পিছফালে পাইছে
ভিতৰৰ ফালে গুৰিৰ দাঁতত
হয় আপুনি কি আপুনি এনে টুথপিক বা এই জাতীয় বস্তু খুবকে ইউজ কৰে নেকি
কি কয়
টুথপিক বা জাতীয় বস্তু ইউজ কৰে নেকি সফা কৰিবলৈ
নাই নকৰো
আচ্ছা ঠিক আছে তেতিয়াহ'লে আপোনাক মই সেম বস্তু এডভাইস কৰিম আপুনি তাতে সেই এৰিয়াটো ইণ্টাৰডেণ্টেল যিটো ক্লিনিং হয় সেইটো আপোনাৰ টুথব্ৰাছেৰে পচিবল নহ'ব আপুনি ইমিডিয়েটলি গৈ এটা স্কেলিং এণ্ড পলিচিং কৰাবই লাগিব আপুনি খাই থাকিলে তাতে কেতিয়াবা বস্তু বজিব পাৰে যিটো টুথব্ৰাছেৰে ওলাই নাহে
All right, all right. Thank you so much for calling. I'm sure the question which you have asked and the answer which doctor gave you must be benefited for you. Now, doctor, this is also another very common question, and the same thing which you have mentioned to the other viewer and also to the viewer who have just called us, that scaling and mapping is very important for this, and a consultant and a consultancy is also very important for to go and immediately see a dentist. Then my next question to you would be that when is the right time to see a dentist? When will the person understand that, okay, I'm having a problem and I should immediately go and see a dentist? Because we have seen people ignoring things, like suppose if they have a pain in their tooth, so they just maybe take a little bit of warm water with a salty water, and if it's a bit pretty healed, then they ignore it. So is that the not the right time, or is that the right time when they have to go and see a dentist immediately to rule out the exact cause of the pain?
See, in my suggestion, I'll tell you that in case you have any pain, you must visit a doctor as soon as possible.
Okay.
Other than that, every 6 months, you just go for a general checkup.
If the pain increases for quite a few days, then to immediately you have to
Within 48 hours, you have to go and show.
Okay.
And avoid self-medication. That is one of the main thing. Which can even worsen the situation. So you need to rule out that.
Okay, doctor, we have a caller. Let's take the call. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মই ডক্টৰক সুধিব বিচাৰিছিলো একচুয়ালি মই ডেইলি ব্ৰাশ কৰো বা এতিয়া তাৰ মানে এনেকুৱা হৈছে যে মোৰ দাঁতৰ থিকনেস বিলাক অলপ কমি আহিছে মানে অলপ পাতল হোৱা যেন ফিল কৰো
হয়
এটো কাৰণে কিবা কি কৰিব লাগিব
হয় আপুনি সার্কুলার মোশনত ব্ৰাশটো কৰিব আৰু আল্ট্ৰা সফট টুথব্ৰাশটো ল'ব লাগিব আল্ট্ৰা সেনসিটিভ বা আল্ট্ৰা সফট হার্ড বা মিডিয়ামটো নল'ব আৰু যিমান পাৰে সফটটো এভয়েড কৰি আল্ট্ৰা সফট বুলি আহে
আচ্ছা
আল্ট্ৰা সফট বা আল্ট্ৰা সেনসিটিভ টুথব্ৰাশটো ইউজ কৰিব আৰু আপোনাৰ কিছুমান স্পেশাল টুথপেষ্ট আছে ফৰ সেনসিটিভ টুথ আৰু ইন কেস অফ এক্সেসিভ প্ৰেছাৰ যদি আপুনি এপ্লাই কৰি ফৰ এ লং টাৰ্ম আপুনি ব্ৰাশ কৰে তেতিয়াও আপোনাৰ সুপাৰফিশিয়াল লেয়াৰটো ক্ষয় যাব পাৰে যেটো এজন ডেন্টাল সাৰ্জনে চেক কৰি পেলাই আপোনাক কৈ দিব
আৰু স্যাৰ কিবা ডায়েট আছে নেকি যে দাঁতৰ ষ্ট্ৰেংথ বঢ়াবৰ কাৰণে
আপুনি এনে হাই ক্যালসিয়াম ডায়েটটো সদায় মেইনটেইন কৰক গাখীৰ খাব মিল্ক প্ৰডাক্টস খাব নেমুটো সদায় খাব ভিটামিন সি ইজ ভেৰি মাচ ৰিকোয়াৰ্ড ফৰ গুড ওরাল হেলথ
All right. Thank you so much for calling. All right, we'll have to take a break. All right, doctor, we'll continue with the conversation, but we'll slip into a short break. We'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Kaushik Sarmah regarding the common oral problems. Now, doctor, coming back to you again, we were talking regarding that when is the right time to see a doctor, and if we talk about the common symptoms, that will also give us an idea that we should immediately go and see a dentist. So, when is the right time?
Yeah, like we started, if you have a pain which doesn't subside by itself, you should immediately go within 48 hours.
Okay.
Same way, if you notice an ulcer in the oral region, suppose in your tongue or in the skin, which is not healing by itself within 1 week, you supposed to go to a dentist as soon as possible.
Okay.
To rule out, an ulcer can be because of many reasons.
Many reasons.
So your doctor will explain to you regarding that. So these are things we should not forget.
Doctor, you have come across quite a good number of patients coming for different kinds of problems as well. Now, when they come to you regarding a problem which has already been exaggerated, and it's you should have mentioned him that you should have come a bit early. So, what was the problem? What was the exact problem with that patient, and why did that patient do late to come to you?
Oh. That most commonly we see in the cases of third molar eruptions.
Okay.
You see, usually it doesn't erupt till you are 17 to 21 years of age. You must be seeing patients in 22, 23 years of age with severe pain. Sometimes they might give pain in the later
Are we talking about the
stages.
wisdom tooth?
The wisdom tooth,
Wisdom
the third
tooth, but
molar.
very common.
Exactly. So it might give you pain when you are 35 years old also. So that time, earlier when we notice in their first visit, we take an X-ray, we explain them, you're supposed to take this out as soon as possible.
Okay.
So they neglect it and they take antibiotic, and in spite of us telling that antibiotics won't work more than 15 days, they forget it.
That will give you just temporary relief.
Temporary relief. And then after 6 months, suddenly they realize that, and these type of infection goes for acute infection.
Okay.
Overnight you will develop a swelling and there is inability to breathe or eat or open your mouth. Then they will panic and call. And
So does that lead to dental implant also? Is there anything that is also related?
Implants are a different thing.
Different thing.
It's a thing for replacement of missing tooth.
Okay,
Suppose
okay.
third molars are need not to be replaced. On the other hand, if you have any other tooth removed for any other thing or accident or any cause, implant is a thing for permanent fixed artificial tooth.
Okay. Doctor, we would also like to know about the maxillofacial surgeon. Now,
Yeah.
what is the role of maxillofacial
Yeah.
surgeon?
Maxillofacial surgeons are those people who are specialized in surgery related to your upper and lower jaw related,
Okay.
head and neck related area.
Okay,
That
okay.
includes your tooth, your tongue, or any malignancy arising from dental region, or your jaw bones,
Okay.
any trauma cases involving your facial bones, or even your cosmetic surgery, the
Okay.
one which is going on very fast, developing very fast. So cosmetics, and then some congenital defects are there,
Okay.
by birth defects in the head and neck region, like cleft lip and cleft palate. These are all things that comes under oral and maxillofacial surgery.
So how common has this become in India, or if we talk about the Northeast, how people are aware about this surgery?
Yeah, people were not aware before, but slowly they are getting a hang of it, because nowadays social media is also so, Facebook and Insta and everything is there.
Okay.
But relatively Northeast is still, I would say, much more behind than say southern region or something. But we are coming up at a tremendous good speed.
Okay. Now, if we talk about the role of oral and maxillofacial surgery,
Right.
so is it different? Is it common? What exactly we would like to tell on this?
Oral and maxillofacial surgery is the same thing.
Surgery is the same.
What we operate.
Okay.
The procedures are known as that.
Okay.
That's
So what is the first thing, like suppose if a patient comes to you, what is the procedure process? What is the first thing you do? You diagnose the problem and then the tests start, and what
Yeah.
is the exact procedure? What is the process?
Yeah, first we rule out the reason why he is here. So once we take the history, then we go for investigations.
Okay.
If he needs a surgical or a conservative method. If it's a surgical, he has to go to a routine blood test and couple of radiological examination, maybe a CT, to rule out the main pathology or the fracture or whatever the cause is. Or if it's a conservative, then it's totally different
Okay.
line of treatment.
Okay. Now, doctor, one of our viewers have also asked about the proper diet for dental things.
Yeah.
So now that is also very important to have
Yeah.
a proper lifestyle, a proper diet to have a proper teeth.
Definitely.
So on that note, what would you like to tell our viewers?
I would like to suggest that there is a very heavy increase in fast food. So reduce that.
Okay.
Promote more of vegetables and fruits at home,
Okay.
especially for growing kids. Fruits and vegetables, this is the age where you have to stock your body with these supplements, because after one age there is only depletion of these stocks. So best is natural way is the best way. Like I said, lemon juice. If you just make it a habit of taking a regular 1 glass of lemon juice, it's good for your immunity, for your oral health, for everything. Likewise, you need to focus on protein.
Okay.
Fish protein, fish, meat, like that, not deep fried, and after it's denatured, then it's no point.
Okay.
So food is one of the major thing.
And doctor, we have seen there are a lot of products in the market.
Right.
So people also get confused before to choose which product is good for their dental habits. Now, on that note, for a sensitive tooth or for the normal tooth, do you suggest them to go for a medicated like kind of product, or do you suggest them to choose a product which is actually helpful for them?
I would suggest, because the composition matters, not the ads, not the brand name, the composition matters. So it's best, if you have an issue, please do visit your dentist. He will prescribe you.
Okay, okay. Because there are a lot of products. So on that note, if the people are choosing the products which are available in markets with different brands, so do you ask them when the patient comes to you which product you are using, and do you ask them to immediately stop that? Because we have seen that few people are already acquainted with or habituated with those products, and when they just shift to some other product, they get kind of like ulcer or some other kind of problem. Maybe they are not adjusted with the new products. So on that note, what do you tell them?
Yeah, as I said, it depends on the composition, which they are unaware of. But we know that this is harmful for your health.
Though it's suiting you, but it's harmful for you.
Yeah, it's harmful. So it's not supposed to be there.
Okay, okay.
It might make the taste good, but it's not supposed to be there.
Okay. Now, doctor, a lot of awareness has to be done.
Right.
A lot of awareness has to be done, be it in a purpose of being in a terms in the institutions, or maybe doctors like you, the hospitals, can also aware people regarding the, like, suppose the new surgery, which is like on maxillofacial. Yeah. So this has to be known to people that what exactly the term is. So on that note, like, how awareness is important for people, and how do you plan to do that?
See, in this thing, I would like to involve both the parties. The institute should take a very bold role in that, through students going to rural areas. At the same time, hospital setups with dental wing, of course, they can also promote these things by camps, different types of camps.
So have you also organized such kind of camps, doctor? Like, what was the response from the people?
Oh, very
Do
good
people
response. Here
also
from
want to come?
Healthcity Hospital, we have done few health camps.
Okay.
We got a very good response. Lot of people have turned up.
Okay.
Residential areas.
And how important is to reach to the rural areas as well, because there is a lot of lack of awareness among the people. Now, the basic things to brush your teeth every day, that awareness has to be there in the people. So on that note, like doctors like you, how do you plan up to do things to aware people?
That's where this institution also has to play.
Different NGOs have also come up helping people.
Institutions, NGOs plus hospitals set up.
Okay.
They need to visit. Suppose there are 3 villages in one particular area. So we have to have a unit. So weekly once that institution is taking care, or maybe next month some other institution is going for just
so simultaneously
awareness.
Things have been done.
Exactly. It has to be planned that way.
And what kind of response do you get from the rural people out there? How the people come up and listen to you and patiently, but depends on them how they are going to follow that in their lifestyle.
They do follow to an extent.
They do follow. Okay.
Some of them do turn up to cities for treatment ways also, but it's our duty to put in their mind the importance of diet or anything,
and the dental care
and
as
the
well.
dental care.
Okay. Now, doctor, we are really short of time, so what kind of tips you would like to give our viewers who are watching our show? Overall tips, like regarding their dental care, regarding the dietary part, and also the physical fitness, because that also keeps you healthy in all terms.
Right. I would suggest them always go for fresh fruits and vegetables, lot of vitamin C, lemon, oranges, mosambi, whatever you can find, and daily twice brushing, morning and night before you go to bed, and flossing and tongue cleaning, 2 basic steps. Don't forget that to include in your daily routine. And do visit a dentist every 6 months for a checkup.
All right. Thank you so much for those lovely suggestions at this point in time. Our viewers must be benefited with those suggestions this doctor gave. So with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.